So the World Bank has been one of the first and the largest financiers of the COVID response for the government of the Gambia. We started off with our COVID-19 preparedness and response project, which is currently an $18.94 million project supporting the COVID health response and also supporting access and deployment of COVID-19 vaccines. As part of that project, we have supported the NDEMBAN clinic, which is now the Edward Francis Small Teaching Hospital.
As the COVID-19 pandemic took up last year, Gambia didn't have any infectious disease specialty hospital, and we had no choice but to hurriedly get sanatorium, which used to be for TB treatment, and get ready to be used for isolation of patients who were COVID positive. And knowing that sanatorium, it's one, the position or the location of the place is quite swampy, and then it is not really a place meant for an infectious disease hospital, then it had to be repurposed. This was a difficult task.
So I felt that it was my responsibility as a Gambian and as a philanthropist to go into NDEMBAN and rehabilitate it, refurbish it in such a way that it can accommodate patients that were positive for COVID-19. We are committing $2 million into the renovation of NDEMBAN Clinic, which will be the main treatment center, within the peri-urban area.
So NDEMBAN construction started actually first with a private support, but eventually that was not sufficient really to complete the whole process. So this is where World Bank and UNDP added.
We have supported that the renovation of the clinic and the procurement of equipment, high-end equipment for the hospital as well.
So for us, as UNDP, that was looking at the impact, the socio-economic impact of the pandemic in the people of the Gambia, we very much welcome this PPP partnership because having a private sector interested in the health sector can really reinforce the engagement as a whole society, but also upgrade also the quality of the services that are provided.
Sanatorium, we used to have only 34 bedded. Here we have 66 to almost 99 bedded hospital, and the facilities are more. We have two portions for ICU care. We have a portion for HDU. We have a theater around. We have a hemodialysis unit that is in the making. So it's quite an all-inclusive or all-care, a holistic care place.
So we are very delighted of this experience. We know that we are moving to a rehabilitation that gives a full-fledged hospital, but also to provide oxygen for the whole country.
This facility can act as a model for us bringing together all the partners to achieve our desired goals.
With a good leadership, with commitment, with the nation at heart, all these agencies can come together to make a meaningful impact on the care of patients, especially during these dire times of COVID-19. Certainly, we encourage this kind of partnership in many of our activities because each party has a big input in such a partnership. Each party comes in with a lot of advantage and experience in making sure that such partnerships work.